what's up, YouTube? First of all, I want to say thank you for all the, for the greetings that I received in the month of July 2021, because that's the time that I passed my NCLEX RN. And just right now, month of August, yesterday, August 6th, I received this the very important certificate. Yeah. Before I open this one, I want to introduce myself. I am Mary Rose Sharon Clark. I'm a registered nurse here in the United States, and I'm a foreign graduate from the Philippines. I'm very proud of being a Filipino, and to all the Filipinos right there, what's up? All right, so yesterday I received a very important package that you've been waiting for a long time, or this is one of your biggest dreams. Now, how to be, how to feel that you are a registered nurse. So I received this package from New York Board of Nursing. So yesterday, it says here, right? Look at this, guys. Do not bend or fold. But when I found out in my mailbox, it was like this. So I was like, don't do that. That is my certificate. Yes, it is a certificate inside. This is one of the biggest dream of everybody, like foreigner nursing students. Well, all those NCLEX test taker, wait for your success. All right, so it's your time. Just keep studying hard, and also you keep believing on yourself that you will pass this NCLEX. So right now, I want to show you what I got in this package. It has 3 papers. Yeah. The first one is, it tells you it's most of the information that what is inside this package. It says here the congratulations on licensure. Yep, there you go. So I don't want to show it in there, so you can see the address. So this is the very important one. Yep. When I saw this one in the mail, I was like, oh gosh, thank God. I've been waiting this for 4 years. Could you believe that? For 4 years. I keep studying a lot of review materials. I tried everything. Those are not working for me, but it's all right. Don't give up, right, guys? So hold on. Yep. After this one, they're gonna show you this certificate that you're already passed your NCLEX, and the third paper is the license now. So I cannot show you because it has all the informations that all information about me. So that's it. Alright, so yep. I just want to show you everything that I got or what I experienced for my NCLEX RN. So the first review material that I used is the Remar. Yep. Alright, so the Remar. I got 5-star NCLEX quick facts. Yep. If you're gonna buy or avail this one, you have to go to their website, the Remar website. Shout out to Miss Regina. Hopefully you're watching this one. I want to say thank you, and the review is very informative and very detailed, and I highly recommend this to all the international nurses also as well. So yep, here you go. Yes, guys, you don't have to memorize all of this. All you have to do is to study it, you don't need to memorize, because if you keep memorizing in the front of the board exam, or if you are anxious, you might forget it. So for me, you have to understand. You have to understand all the topics, especially like the pathophysiology. You have to know about that one, because sometimes if we keep memorizing all the stuff and we get like the anxiety in front of the computer in person view, sometimes we're gonna forget it. You're like in a panic mode. So for me, the best technique is to like focus, and then on each question you have to understand it and look at the clue at the end of the question. For example, with the word first at the end of the question, you have to prioritize. You have to find the answers that is like related to the question, because you will find out how to do it if you keep practicing on a question bank. That's why they making a question bank like UWorld. I use UWorld also as well. UWorld has I think more than 1,700 for something like that. So I have a lot of hold on. Yep, I'm gonna tell you about UWorld, okay? Because I used UWorld for how many times? I used that for my LPN board exam also, and I used again for my NCLEX RN. So you better know how to use it, because most of the students, they keep using it. Like they're doing 75 questions in every day, which is they don't understand all the rationales. The main idea here is to answer those questions. You need to like digest all the rationales, understand it. This is not erasing. NCLEX is not erasing as well. You have to digest all the question, or you have to understand the way the NCLEX attacked. This is really hard to this exam is really hard. I can tell. Even you can tell that yourself that I'm really prepared. I'm really prepared right now. Like I know I can. Yeah, that's a good one. You are very confident for yourself, but don't put 100% confident on this exam, because what if you even you're gonna pass it and you found that you still failed, right? So don't put 100% that you can you know that you're gonna pass this exam. Because I've been through a lot of like I took this exam for how many times also. Like I feel like very confident that I'm gonna pass this, but as long you're in the front of the computer, you didn't stop for 75. Don't put yourself like you're gonna I'm gonna stop in 75 like this. I know I'm the very smart student at school. I'm always on the top level of I mean like in an honor roll. No, just keep going, answer it, and understand all the question. As long you know how to prioritize it, you will pass that board, right? So yeah, let's go back to this topic, the NCLEX. Yep, I availed the NCLEX Remar BT. Yeah, I finished that one, and also the quick facts. I read this one also. They will give you a schedule now how to read the quick facts. Like for example, on first day you have to read 10 pages, and the next day 10 pages again, finish 15 pages on Wednesday, like that. So it's, if you want to try it, just look at their website, Remar. Thank you, Miss Regina. So yeah, it comes also with this one, because when I availed this one, I think they have a promo, or probably there's a special event sometimes they will give you a discount, so I grabbed that opportunity. So I got this first shift. Well, I'm starting to reading right now, so look at this. I have a bookmark. I love first shift, and I love this Remar. I give a 5-star or 10-star for that. And also I use the, hold on, I want to show you this one. So I got that. So I finished the Remar, right? Remar BD. After that, you're gonna receive this certificate of achievement that you finished the whole virtual trainer. Now you already watched all the lessons. Yeah, you're gonna receive that certificate as well. And what I got is I tried also the archer review. Yep. What can I say about the archer review? It's very detailed also, very helpful, highly recommended to all nursing students. Yep. And I don't know what I forgot her name, and the lady that talking in the live video that is recorded, she was really good. I want to rate her like 10 stars for me, like 100%. She's really a good teacher. Yep. Shout out for her. I don't know her name, I forgot. So, but archer review was really good. I bailed. I think what I did is the Archer NCLEX Rapid Review on demand, and has 2 months access, and also I think it has a Q bank as well. I finished all the Q bank too, and yeah, for me it's very helpful also. And I need more content, so I used also a UWorld, the best. I keep saying UWorld. UWorld has lots of questions that are very challenging, and it's really hard, especially the select all that applies. Wow, okay. I cannot say something about UWorld, because it was really harder than the real NCLEX word exam. The question is very long, and you're gonna think a lot. Like, you're gonna use your knowledge on how to answer it, and let's talk about that later on. Let's finish this archer. Right, so when I availed the archer, of course, if you finish the whole lesson, you watch all the live video or all the recorded video, they're gonna give you a certificate as well that you it's a proof that you finished the whole review. And these are the schedules. Yep, you can get this one once you avail the 2-month access of the archer. Probably I forgot how much it is, because sometimes they keep giving you a combo code, like it will give you a discount if you use the code. Just check their website, so I'm gonna put it right over there. Yeah, just check their website, and also their Facebook also, because they keep posting all the codes. Those codes are discount codes, and sometimes they put everything in there, like a package, everything, like the live reviews, Q banks, that is much cheaper than the UWorld. If you are like saving money, you can use Archer as well. So right now we're gonna talk about UWorld. UWorld is like a symbol like this. Yep. All the NCLEX RN test takers, they're using this one. Most of them are using other Q banks, but this one, it's like a word of mouth. Everybody's talking about UWorld. And at first for the first time I used UWorld, I don't know how to use it. I just keep answering it like 75. I saw a lot of comments about their using the UWorld. They're answering 75 questions every day, which is that's too much. 75 questions every day, and then you want to finish all the Q bank. Um, and then most of the time you cannot understand anymore because you're just like in the racing. You want to finish all the Q bank and without understanding. So that's how I used UWorld before the first time I tried to use it. So on the second time I use it again, still don't know how to use it. So I don't know, just keep answering it, keep using it, keep buying it. I spend a lot of money for that because I heard a lot of students that they were using it. So I think I've used it for 6 times as well. but luckily I found Dr. Sishan, and shout out to Dr. Sishan. Hopefully you're watching this one. I think he owns that NCLEX High Yield. Yep. NCLEX High Yield was very helpful also, right there. That's what it looks like. You can find it in Instagram. They have a free Zoom meeting, which is you don't need to spend $1, like $100 or $499. Just watch his all videos, like YouTube. He got also a lot of free videos and any kind of stuff, like all the topics that are very very important that comes up from the NCLEX board exam. So yeah, I watch all his videos in YouTube, starting for example cardio and that ask graph, like ask graph, ASKGRAPH. It's an acronym. Like A stands for AOA, which is the on the top level, like you have to prioritize. The next one is sepsis. K is potassium. Yeah, and you have, those are the acronyms that you need to prioritize. So you have to remember those when you're in the front of the board exam, the NCLEX, because that is the biggest the important one if you're answering the NCLEX. So yep. What else? Ask graph. That's from Dr. Sishan. Dr. Sishan, sorry. So yep, watch the Instagram videos and YouTube, and also he got also Spotify. I don't know how many yep, I'm using my phone right now so I cannot see. He got also in Spotify, which is a free podcast. He will teach you the steps how to use the UWorld. And what I really like about it, he will give you some techniques how to use the UWorld. So right now, from the 5th time or 6th times that I use the UWorld, now I know how to use it now. Well, yeah, that's very helpful. And he will tell you, for example, it has 1,700 questions in UWorld. The technique is every day you have to answer it 40 in the morning, 40 questions in the morning, 40 in the afternoon, 40 in the afternoon as well, you have time, and then 40 at night. So it's like, that is 40 times 60. So I'm just gonna do the math. All right, so probably it's gonna be 165 per I think. So it's more than the 75, but you understand it, right? In 40 questions you have to review all the rationales, or you have to review those topics that you really need to focus on it. For example, you have 10 mistakes, you have to study those 10 mistakes first, then read all those corrects also as well. Don't ignore those correct answers, or because most of it has a good rationales and might help you. Yep, 40 questions morning and then afternoon, and then that's in one day you already 165. On the next day, keep doing that until you finish the whole Q bank, and then keep reviewing it over and over and over. Read all the rationales, and that's it. So also, what advices that I can give to you is, I have lots of review materials right here. So comment down below if you need something. For example, you need all the materials that I have PDF files. Maybe I can help you. Just message me down there in the comment section, and yep, I'll show you what else I have here. Yes, I got this standard precautions, which is also one of the high yield in NCLEX. It will come out to your NCLEX board exam. Those are standard precaution, contact precautions, droplet precautions, and airborne. They're hard to pronounce it. Airborne precautions. Yeah. What are the PPEs that you're gonna wear for this each precautions? You have to remember that too. We have to remember all the basic also. Basic stuff, basic content. Since when you were like a freshman in nursing course. Yep. And keep saying yep, right? So the insulin, yeah. These are priority also. The insulins that are the onset, peak, duration. Yeah, memorize that one because we're gonna use that in a work field. Yeah, it's very important. And also, what else to tell you? Yeah, don't forget the cranial nerve. Yeah, have some techniques also in cranial nerves. The easiest part of this, you can remember this by if you are like you're thinking something crazy, like using acronyms in a like a pervert. Sorry about that word. So you're using it's like a O to touch and feel, blah blah blah, like that. So I think all the nursing students knows about that, right? So sorry about the word that I said about those. So yeah, and also the parts of the brain. Review that too. Use UWorld and you will tackle this topic. Yeah, the frontal, parietal, left temporal, occipital. Yep. I printed those stuff so you keep reviewing this one before your board exam, right? You don't need to memorize. Our brain has like a gigabyte or something memory. Sometimes it get full, right? We get tired, exhausted for memorizing all the stuff. No, you don't need it. You have to understand the topics. Yeah, that's still the brain. Yep. I keep printing all the stuff that makes me confused, and I keep looking at the scan all the printed papers until I understand it. So yeah, it will tell you the parietal lobe. Scope of practice, yes, this is the biggest also topic in the NCLEX. Scope of practice, what is the scope of practice of an RN, LPN, and the CNA or UAAP, CNA or PCT or whatever. Like because in every state they call it like UAP. Most of the states they call it CNA. Yes, I've been a CNA also. I've been a LPN, so I know what's their scope of practice. So you can play, you can navigate it in a board exam. It will ask you what is what is the RN gonna do with the LPN? What kind of activities that he or she can tell to the LPN, like that. So you will understand it, okay, if you try the question bank. Number 1, keep practicing on the Q bank. That's the reason why you're gonna pass your NCLEX, so keep practicing answering the Q bank. So you know how to prioritize it. You know how to answer select all that apply. It's because you use the true or false, and you also understand the pathophysiology. Yeah. And all this are the visual disturbances, like a retinal detachment, what it looks like this. You have to print it, so you have to understand. You will understand what are those. Cataract, it's kind of blurred, right? Or glaucoma, primary open angle glaucoma, just like here. It's like a tunnel vision. It is a tunnel vision. Yep, it is a tunnel vision. Only you can see is in the middle. You feel like you're in a tunnel. Age-related macular degeneration, just black in the middle. Yes, this is one of my favorite. Yes, that one. Heart auscultation. This is how you use your stethoscope. Like you're doing this from the second ICS, intercostal space, then go here to, this is from the right, and this is for the left. Second, third, and fourth, nothing in there. Fifth, and this is the midclavicular line. Yep. And then there is a question that they're gonna ask you, where can you find the apical pulse? So it's in the mitral, right there. Yep, you will learn that in UWorld too. Yes, I'm just showing you all the stuff that I used for my NCLEX preparation. Can you see that one? That is a hemianopsia, like in neuro. If the patient has a problem with left hemisphere in the brain, so the affected is the right one. So yeah. And the one of the high yield, the question number 1 and question in the, this is a, what is this one? Yeah, a chest tube. Yep, this is a chest tube. Yeah, I will tell you which one is the suction chamber, water seal chamber. Yeah, review that one too. Yeah, after liver biopsy, the positioning, review that one, guys. Review those stuff. Positioning. One of the favorite questions in NCLEX. The real NCLEX exam. Yeah. This one is after liver biopsy. They were on the right side. And this is before. Yeah, that's the position of while they're doing the biopsy. Yeah, you have to raise the arm of the patient like that. Yeah, and the IV solutions. Isotonic, what are those isotonic, hypotonic, hypertonic? You have to know about that. Because we're using that in the hospital, even in a skilled nursing facility. If they have an IV, you have to review that one also. Don't forget that, guys. Yeah, there you go. I got this from the Instagram, Dr. Sishan. I just want to remember this one, so I screenshot this one. Quick tip about the treatment of angina. Yes, so many stuff. Everything is in UWorld, all mixed up. As long it is very helpful on your studying. Yeah, NCLEX high yield. and Piaget. I don't know if I'm pronouncing it right. Piaget. What's this? Piaget periods of cognitive, like, you know, the sensory motor, pre-op, concrete, formal. Yes. The TB. You know, guys, you have to review this one also, the TB. You know, the size when you do that skin testing, whatever, the PPD skin test. If it's more than 15 millimeter, it will tell you it's a positive test, right? So you have to review that too. Lumbar puncture is one of the positioning also. What's the position? Is the C shape, right? Even the C shape or sitting down like this, hunchback. And I think the kids, if they're doing it in the pedia, they're doing like this too. Like, you know, shrimp position. And then scene position. When you do the, for enema administration, yeah, review all the positioning. If you want to write it down what I'm saying, you write it down, because those are like coming out from your board exam as well, I know. Paracentesis, yes. The position is like this. They were sitting like that. And I think paracentesis, hold on. I think if they're doing this procedure, the patient needs to, I forgot that one, if they need to like urinate first. Yeah, I think they need to go to the bathroom first and urinate, because they might get puncture the, you know, what vascular organ inside there. So I believe there needs to be, or correct me if I'm wrong, right? So yeah, milestone of infants. Yeah, pedia. What are their developmental? Put all the insulin also, because I keep forgetting the insulins. Even though I'm doing that as my job as a LPN, because I'm doing those blood glucose, they're checking all the blood glucose levels of the residents. I need to know about this, like the insulins. What kind of insulins? Is it long acting, rapid acting? You have to know about that. Okay, we're nurses. All right, so cardiac catheterization. Where are they what place they're doing that? Oh yeah, in the groin. Yeah, it could be in arm or in the groin. What else? Yeah, heart auscultation, my favorite. So that's why I keep printing it. Alright, so this is the chest compression for the babies. Less than 12 months. That's how they do. How they do the CPR for the babies. Look at that. Could be like this. Two of your fingers. Doing like that. And then, or you can do also using your thumb. Like this. If it's less than 12 months, alright guys? Because if it's more than 12 months, you're gonna do the CPR. Like doing like this. Alright, so yes! This one also, PAD, or I think it's peripheral arterial deficiency, I think. Yep. PAD, and also I think there's two, PAD and venous. This one is arterial. What kind of position we're gonna do if they have a peripheral arterial disease? Are they gonna dangle it, or are they gonna elevate it? So for me, my acronym, if it's peripheral arterial, remember the A. They need to I think they need to dangle their legs if they have a symptoms. Or if it's peripheral venous, it could be elevate. You have to elevate their legs. So you have to remember or watch some videos about this. PAD and venous. Arterial and venous. So, yep, I have a schedule. Look at this, guys. June. Yep, I make it organized. Do this also. You can print this free on the website. The calendars. And then I'm kind of like a little bit OCD. I love printing since I was in a high school, keep doing this printing some calendars and do some, like, you know, organize it. For example, on Tuesday I'll do all 40 questions in UWorld, and then I'll start in prioritization, 40 questions for prioritization in UWorld, and then in the afternoon I'll do again a 40 questions, all of the topics. I'll click all the topics in UWorld, all mix up until I got the 165 in one day. And then sometimes if I'm not exhausted, I'm still reading all the mistakes that I had and write it down, all the mistakes. So that's what I did. I will write all the mistakes, write all the rationales. While I'm writing it, my brain is like working, like, okay, so this is the reason why are this disease. So that's because when you're writing it, your brain is trying to, you know, like, digest all the words, and it gives you like clue that, all right, so this is the answer for that. So you should practicing writing it. Probably you're visual learner or audio learner, it might help also with you guys. Yeah, that's why I keep doing that. Yeah, and Tuesday, Wednesday, Thursday, I keep doing that 40 questions for Dr. Sishan. Dr. Sishan, he will teach you how to use the UWorld. 40 question each morning. It depends on you when you're like, you have a free time. So I have a free time right now because I didn't work as an LPN for a while. Just focusing on my NCLEX RN board exam. So I have a lot of time to review all those stuff right here. So if you are working right now and you're doing your NCLEX RN preparation, just don't give up. You can do this like in one day. For example, you're at break on your work. Do something like 40 questions, or I don't know if you can answer 40 questions in 15 minutes break. So but you got this. All of the students, they have time. If you really want to pass the NCLEX, you will do something, a lot of things, because you are really eager to get that license, right? So don't give up, don't be negative. Yeah, that's what your schedule is. Review all wrong and mistake, then take board exam. I didn't know about I write this one. You know, you need to be like futuristic. Yeah. Oh wow. You got this, Sharon. Oh, you see, I'm telling myself. I didn't know that I write this one. I just showing it to you guys. So that's what you're gonna do. You have to be like futuristic. Like you're thinking about, okay, I'm gonna be a nurse. Yeah. Yeah, that one, post biopsy. I showed you those stuff. Alright, so yes, and what else did I use? Look at this, guys. I want to show you also. Hopefully you're still watching this video because this is a very long video. Probably most of you are kind of sleepy right now. Oh gosh, I don't want to watch her anymore. Like she's telling you something like, I don't want to watch her because it's a long video and it's kind of boring. It's up to you guys. I just want to share to you what I did on my NCLEX. And also, as you can see, I'm wearing my uniform, and it's one of the jacket that I really like. And I think I bought this in Amazon, and then like I ordered it, put my name on there, and then this one this patch, I used the iron, bought this patch, and I want to put something in there also. It tells here registered nurse. Yeah, you can use also this one at your work. Yeah, especially when it's winter or it's cold, you can use this one. It's kind of perfect for on duty. You won't get cold, or for example you're a night shift, you can wear also as well like this. Yeah, you can close like that. Yeah. I have my stethoscope also. This stethoscope, I use this in my work in a nursing home. Yes, and you guys already go. It's good, right? I'm wearing my. I'll show you before I show one of the under what I'm holding. The flashcards. Look. Yes, that one using my Crocs. Right, so yeah, this scrubs. I think I bought this in Walmart. They have a nice. They have a nice scrubs right there. Yeah, I like also Figs, those kinds of brand, but Figs is kind of like really expensive, very fancy scrubs. Now this one is like it's cheap and it's nice. You can see it in Walmart. Right, let's go back to review. So yeah, I want to remove this one. Yeah, it's kind of a little bit warm right here. So guys, it looks like I'm live review. This is a live review, but I'm just showing you guys. I hope you like this video and hope you subscribe and like comment whatever you want to say there. It's fine. You have freedom. Alright, so this one I put in the flashcard those stuff that you really need to remember. Crutches, what 2 to 3 finger space, right? So yeah, elbow bent, or you're gonna bend it while you're using that crutches. 5 inches and 8 inches far from foot. So you have to know about those basic. Those are basic, but most of the time it will pop out on your board exam. You will be like this. Why I didn't even review that one? That's so basic. It's like you're gonna blame yourself why you didn't even read that, right? So this one, restrain. Yeah, this is number 1 also. It keeps popping up on my board exam. Yeah, non-violent. The healthcare provider must see patient within 24 hours, something like that. RN assess. You have to assess them every 1 to 2 hours. And the restraint order expires in 24 hours. So you have to order again in the doctor about the restraint. Yeah. Put that down. Jot down in those are basics, but it will come out. What else? The VILCHOP. You know VILCHOP? That's an acronym for maternity. V stands for variable. E stands for early deceleration. A stands for acceleration. L stands for late deceleration, or if there's a late deceleration, you have to do the L. Lion. Yeah, lion stands for left lateral. IV, oxygen, notify the doctor. Yeah, that's from Mark Klimek. The what you call that one? I think that's an audio. Yeah, 12 audios that he had. Well, that's a very famous audio that keeps popping up on the NCLEX group chat in Facebook. They're talking about Mark Klimek. Mark Klimek is really good. Yeah, I used also him, but this time it didn't work for me. So I tried UWorld, that Remar, and also the NCLEX HIGHYIELD. So yeah, these are the flashcards that I keep looking at because I did this for a long time. So I keep looking at the diuretics. What kind of diuretics? Is it loop diuretics? Is it potassium sparing, or is that a mannitol, right? So yeah, anti-neoplastic, herbal meds. Yes, herbal meds. I've learned from the Remar, if it's letter G, that's blood thinners, right? All letter G. I mean, it's, for example, ginger, garlic, any kind of letter G that starts with letter G. Those are like blood thinners, right? So here. And stop stomach acid. I think those are antacids, calcium carbonate or something like that. I need to drop those. Oh gosh, I feel like dehydrated. Okay, insulins, yes, keep telling you about that. Please review that. TB drugs, TB. I don't know what's TB. Supposed to be TB, tuberculosis, right? TB drugs. I think from the TV that you can see in the commercials, in the television, they keep popping out. You have to review that one. Like alendronate, calcium. That's calcium carbonate or something like that. Yeah. Just let me know, guys, if you want to have a copy of this. Oh, benzodiazepine. All the medicines that ends with sepam, diazepam, those are the anti-anxiety medication. Diazepam, with the word diazepam. Yeah, the anxiolytic. You call it anxiolytic medications. Yeah, this one is anticoagulants. Anticoagulants, I'll give you some example of it. Yeah, anticoagulants like Coumadin. Coumadin is, or warfarin. Warfarin, it's a PT, right? PT, and then heparin is PDT. So you have to know what are the therapeutic range of that. Yeah, remember that one, guys. Allergy meds, yes. Antihistamine. Yes, that's a very important one, especially there's a season every morning. You're gonna have a allergic rhinitis. Oh my gosh, those words are very, very like medical terms. Well, you're a nurse, right? So all of you right now watching right now are nurses. Nursing students you are already a nurse, right? So you got this. Okay, so corticosteroids ends with zone, right? Zone or on, like ONE, zone. That's our corticosteroids. Corticosteroids. Yes, that's for my asthma. Cardiac meds, yes. Favorite in the NCLEX. The real NCLEX board exam. You have to review that. Beta blocker ends with LOL. ARBs, sartan. Yes, tell me sartan. Valsartan. That everything that has sartan word at the end. Those are, we call it ARBs. ARBs, sartan. Lowers BP. Beta blockers, LOL. LOL. Ends with LOL. Those are decreases the BP, blood pressure. Yeah, dipine, calcium blockers, dipines, calcium, CCB, dipines ends with dipines. Yeah, do like this, guys. So you will like, if you're in free time, they would like this. Aspril, like, yep, that's what I do. Make it fun, like, so you won't get bored. Because sometimes you will get bored in nursing. You get exhausted, very stressful, especially at work. You're very serious right now. Nobody will mess you up because you're not in a mood, but don't do that, right? Yeah, GI meds. Yeah, GI meds. So many. Yeah, anticonvulsant, very important one. Antipsychotics, yes, this one. Typical and atypical. Yeah, you have to know about what's typical is. Typical could be ends with a dol, or yeah, like Haldol. God. And psych meds, yes, this is one of the, oh gosh, all the stuff that I'm showing to you right now, those are very important. So psych meds, they have like lithium. Let me put this down here. Lithium is for mood stabilizer, right? Maui, yes, Maui, you have to know that. It comes out, Maui also, it will come out to your NCLEX. That's their favorite questions. They keep asking you, what is the diet? What are the foods that they're not allowed to eat? Where are they using Maui? SSRI. Yes, SSRI also. Yes, sometimes those medication you cannot use it at the same time. SSRI or MAUI, you're not supposed to mix it up. And what I believe, I still remember, you cannot mix it up. The patient's using SSRI, and then he got also, or he or she had this MAOY medication, and you cannot mix it at the same time. I think you need to taper, something like that. So you have to, that's why we need to research about it, right? So antidepressant, yeah, psych meds, put it down. All right, respiratory meds, yes, one of them, the important one. You have to know about which one are the bronchodilators, which one are the corticosteroids, and which one is the first one that you're gonna use if the patient has an asthma. Yeah, what medication first you're gonna use before you use the other respiratory medication. So yeah, analgesic, NSAIDs, yeah, NSAIDs, like NSAIDs are, let's give one example. The NSAIDs is a blood thinner also, so be careful with the NSAIDs. Aspirin is a blood thinner also as well. And insulin or antidotes, you have to know about the antidotes, guys. Antidotes, for example, I'll give you one example of this. All right, so insulin will lessen your blood sugar level, right? So if the patient is really low in blood glucose, you have to give them a glucagon. That's the antidote, glucagon, right? Yeah, those are my yeah. Maternity meds, yes. I clipped this one in one, so it's organized. Antibiotics, yes. Remember that one, the peak and trough, or I don't know what's the right trough, or I think trough, peak and trough. Correct me if I'm wrong. And yeah, anti-arrhythmic meds, like those medications that are for AFib, BFib, BTAC, amiodarone. That's amiodarone. It slows the heart rate. And anti-Parkinson's. You know what's anti-Parkinson's, right? Pill rolling, shuffling gait. So if they're having that symptoms, you have to anti-Parkinson easy. So guys, I think that's all of I had right now. That's what I use. And also, lastly, I think I have this one. I saw this on the, like, what group is that? NCLEX group in FB. Look at this. It's from, I saw it and then I downloaded from Barbaro. And it was so good because everything is there. Well, just keep searching and talk to your friends right there or whatever in the NCLEX group right there. I'm not trying to advertise it because I'm not the one who made that video. I'm not the one who made that groups also in Facebook. But you gotta check it out. Alright guys, so that's it. Well, hope you like all this stuff that I'm saying. Hopefully I, like, help you, and just comment down below and don't forget to like and subscribe. Thank you guys for, watching this video, and hope you enjoyed. Please don't forget to hit like and subscribe to my channel. Thank you.